Hi friends, I'm Dr. Mohammed. Thanks for watching. Now let's talk about Velocef capsule uses, side effects and price in Pakistan. Velocef is an FDA approved antibiotic containing Cephradine. It is used for the treatment of various bacterial infections, especially those in the respiratory and skin systems. Due to its potent nature, it's available only through prescription, ensuring its use appropriately for the right conditions. Cephradine targets the final stage of peptidoglycan synthesis in the bacterial cell wall. It achieves this by binding to specific proteins known as penicillin-binding proteins. This binding disrupts cell wall formation, resulting in the death of the bacteria. The price of the Velocef capsule in Pakistan ranges between 30 and 32 rupees per capsule. The price can vary depending on the manufacturer. Velocef is an antibiotic that is used during the following conditions. Urinary tract infections. Velocef 500 mg effectively targets and eradicates bacteria responsible for UTIs, ensuring a rapid clinical response. Sinusitis. Velocef addresses the underlying bacterial causes of sinusitis, reducing inflammation and relieving symptoms. Otitis media. Velocef is prescribed to eliminate bacteria causing middle ear infections, thereby reducing associated symptoms. Respiratory tract infections. The antibiotic is effective against common upper and lower respiratory tract pathogens. It is commonly prescribed for tonsillitis, sinusitis, pneumonia, etc. Infections of the oral cavity. The drug combats bacteria causing oral infections, ensuring oral health and reducing complications. Meningitis. For bacterial meningitis, Velocef 500 mg effectively neutralizes the causative pathogens. Skin infections. The drug effectively targets skin-invading bacteria, ensuring rapid skin healing. In addition, it is the first-line antibiotic indicated for a wide range of infectious diseases caused by bacterial pathogens. Take the antibiotic following the dosage and dosing frequency as prescribed. Avoid breaking the capsule and take it as a whole with water. The antibiotic is usually prescribed twice a day. Take the medicine at the same time each day to increase its efficacy. It is not advised, otherwise the treatment should continue for 3 to 5 days with Velocef. Avoid the prolonged use of Velocef as it can result in the development of bacterial resistance. The most common side effects that are reported with the use of Velocef include nausea and vomiting, mild skin rash, allergic reactions, dyspnea, blood disorders such as leukopenia and neutropenia, pruritus, joints pain, vaginitis. Cephradine is classified as FDA pregnancy category B. While animal studies haven't shown evidence of harm to the fetus, there is limited data on its effect on human pregnancies. It should be prescribed during pregnancy only when the benefits clearly outweigh the potential risks. Additionally, consult a doctor for expert advice since Cephradine can be transferred to breast milk. Velocef is a first-line antibiotic used to treat upper and lower respiratory diseases including throat infection and tonsillitis. The alternative antibiotic brands that can be used in place of Velocef include Cephazolin, Cephalexin, and Augmentin. I hope you liked the video. Please like and share our channel. Subscribe to our channel. Thank you.